Mission brief, why this matters for your family's survival. The media is running with panic. Tylenol in pregnancy might raise autism risk. But while everyone's distracted by headlines, the real operational advantage, the one that could restore a child's ability to communicate, is being buried. Tonight you get the tactical briefing the mainstream missed. A decades-old medical compound, Leucovorin, Folinic acid, has been saving lives in combat zones for generations. Now, new intel shows it's helping non-speaking autistic kids form their first sentences. This isn't Big Pharma's latest experiment. This is proven battlefield-grade medicine, adapted for your family's survival. Stay locked in. I'll arm you with the exact protocol, the diagnostic test you need, and how to secure treatment. Even if the system goes down, let's get you mission ready. Section 1, Threat Assessment, Tylenol Hysteria versus Real-World Risk. Harvard's 2023 meta-analysis, 2 million pregnancies, a modest uptick in neurodevelopmental issues with prolonged acetaminophen use. The media went DEFCON 1, but here's your tactical reality check. Correlation causation, a 2024 Swedish study of 2.4 million kids found no causal link between prenatal Tylenol and autism or ADHD. Remember, untreated fever in pregnancy is a real threat. Preparedness takeaway. In a grid-down world, you need medical intel, not fear-based headlines. Log these facts in your family's medical binder. Section 2, the tactical asset, Leucovorin. Leucovorin is folate's combat-ready twin. Your average vitamins, civilian supply chain, synthetic folic acid, slow to deploy, Leucovorin ready to use, bypasses metabolic choke points, and delivers directly to the brain's command center. Sorosaki Nalza, Weedus and Chinton new. Leucovorin's been in the medical arsenal since 1952, used to rescue cancer patients from chemotoxicity. Now it's showing up as a game changer for a specific autism subgroup, kids blocked by internal saboteurs called folate receptor alpha autoantibodies, FRAAs. Preparedness, take away, know your supply lines. In a crisis, alternative routes for critical nutrients are a force multiplier. Section 3, identifying the enemy FRAAs. About 60-70% of autistic kids have FRAAs, internal saboteurs that block folate from reaching the brain. Standard blood tests look normal. The problem isn't supply, it's logistics. The result, Cerebral Folate Deficiency, CFD. Warning signs, developmental regression, loss of speech, poor sleep, irritability, low muscle tone, seizures, chronic gut issues. Action step, request the FRAT blood test, Cerebral Folate Deficiency screen. Most doctors don't run it, but it's often covered by insurance. Preparedness. Takeaway, document symptoms. Detailed logs can be your best weapon when advocating for care. Section 4, field-tested results. The Arkansas study. Arkansas Children's ran a double-blind placebo-controlled trial. 93 autistic kids. Half got high-dose Leucovorin. After 12 weeks, the treatment group gained an average of 7 months of receptive language in just 3 months. Hyperactivity dropped 30%. Parents reported first full sentences from previously nonverbal kids. Side effects, mild and temporary tummy upset, increased energy, no serious safety issues even at high doses. Protocol 2 day, max 50 ml split into 2 doses. Preparedness, takeaway, field tested, peer reviewed. This is not guesswork. Section 5, mission success, Mateo's story. Case study, Mateo, age 4, no spoken words. His mom, a true prepper, pushed for the FRAT test. Sky-high autoantibodies. They started liquid Leucovorin. By week 6, Bobo hungry. By month 4, full sentences. He's not cured, but now he can communicate pain, needs, danger. That's a survival tool you can't put a price on. Section 6, is your child a candidate? Step 1, get the FRAT blood test or CSF folate level. Step 2, rule out B12 deficiency and seizures. High-dose folate can mask B12 issues. Step 3, consult your specialist. Leucovorin is prescription only and can interact with some anti-seizure meds. Step 4, track progress. Rate speech, meltdowns, sleep. Most see gains by week 4. Clear sentences by week 12. Section 7, safety reality check. Leucovorin safety record. Millions of doses in oncology, decades in newborns, side effects are rare and mild. Always pair with methyl B12 to keep the metabolic cycle running. Recheck blood counts every 6 months. Coordinate with neurology if your child has epilepsy. Section 8, integrating with other therapies. Leucovorin is the breaching charge. It opens the gate for speech and other therapies to work. And some kids stim more the first 2 weeks, system rebooting, the sahiri, then level out. So keep routines predictable. The vitamin opens the door, but therapy walks them through it. Section 9, cost and access. Generic tablets, about 45 cents per 10 milligram pill. Typical protocol, 50 a month out of pocket. Insurance often covers it for cerebral folate deficiency. Compounding pharmacies can make it palatable. Our National Autism Association and Autism Care Today offer grants. Preparedness. Takeaway, secure supply now. Don't wait for the grid to go down. Section 10, the bigger picture. While the world obsesses over Tylenol, a treatable metabolic subset of autism is being ignored. This is about survival, equipping your child with the tools to communicate. In a crisis, being able to express pain, hunger, or danger is not optional. Preparedness is knowledge. Share this intel. If this is the first time you're hearing about FRAA testing in Leucovorin, hit subscribe so YouTube knows this community wants hard data, not mainstream propaganda. Drop your biggest self-reliance win in the comments. Let's give other preppers hope. This is survival. This is resilience. This is suburban prepper.